In this episode, we will talk about the treatment of the stomach in a sitting position. We will repeat the techniques performed in the video about the supine position, but we'll do it in this position. We should consider that the landmarks in this position could be a little lower than in the other position. So we might find our pylorus, which we are now going to look for, maybe not 4 fingers, but 3 fingers above the navel. And our cardia, a little more descending and therefore maybe a little more palpable. I will ask the patient to keep her arms relaxed and take a slightly kyphotic position with her head forward, so that it is easier for me to go in at the subcostal level. Move a little bit forward, please. Very good. I will look for the xiphoid process and position myself to the left of it. At this position, I'm going to have her inhale. She might feel a little pain and exhale. It's a little bit uncomfortable. This is the Manson test, which is positive if the patient stops inhaling. It indicates the presence of the hiatal hernia. Inhale, I have it under my middle finger, and exhale. Okay. At this point, I'm going to look for the navel. I'm going to position myself approximately. Move a little bit forward, please. Okay. 3 fingers above. There it is. Here it will be the pylorus area, which I will be able to hold with my thumb. I will be able to perform the proposed technique in the supine position while sitting, the one on the small curve in which I will inhale, lift the thumb away from the pylorus, exhale. So I'm going to open. In the meantime, I can ask the patient to straighten up a little bit, and I will traction between the pylorus and the cardia.